Gutkowski, and this is New Eyes Dental Hygienist Guided Mastermind. This is my answer to dental hygiene consulting, where people are asking me to consult with their practices, and I'm like, I don't do consulting, and they were like, oh, but you should, and so I figured out finally, it took me a long time to figure out how best to do this for my own mental health and so that it could be the best thing that it could be. And I think this might be the answer as a guided mastermind. Dental hygienists, as a rule, are happy with their career, or are they happy to get out? It's really hard to say. Most hygienists seem to like their jobs pretty well. They like helping people, they like the science, they like the team aspect, they like being part of healthcare. So there's plenty to like about dental hygiene. What they don't like is being asked to stay home. They don't like having to clock out when their patients cancel. They have a fluctuating paycheck because of all the clocking out and staying home. They like being flexible, but it's to the point for some hygienists where it's not fun anymore. They don't like to have to count gloves to see if they're wasting too many gloves or cutting prophy paste in half or asked to be selling. They get a bad taste in their mouth about that. They freak out when they see stuff like this. They don't want their patients to ever end up with this much dentistry. They like to use their brains and their skills. They like to use all parts of their brain. Some are better at it than others, just like every other profession. They love their patients. It's such a big part of a dental hygienist's experience at work that many hygienists stay in the dental practice, even though the environment is abusive to them. So that's a real important piece to this equation here, that they are so enamored with the relationships that they have with their patients, they will put up with extreme conditions, extreme working conditions. Somehow, hygienists feel underappreciated at the dental office. Often, they're the only other person in the office that has a license to protect. They're often the only other person in the office who has any kind of a degree or certification. So what would make an office manager call and ask a hygienist to come in for just a single hour of work? How many days a month could you do it? Really, it's kind of fun to stay home for half a day every now and then, but could you do it 3 days a month or 7 days a month or 20 days a month? Take an extra half a day off? Other than that, what are you going to do? Do you have to have a showdown with the office manager, with the doctor? Are you prepared to threaten legal action? Right? I mean, what are you supposed to do? You know, you bellyache about it to your friends, but there are really very few options that hygienists readily see. So how can you prove what you're worth? What do doctors want anyway? I think a lot of hygienists think that the employers want them to do their job and just to shut up and keep their head down and keep a low profile. What they really want, though, are employees who are engaged in the tasks, that understand that there's a business there, and that they bring ideas to make more money to the practice by offering a wider variety of services that are necessary or that their patients want to have. So what do hygienists want? They want to do their job, they want to provide exceptional care, and they want to bring patients to health. They have big hearts. They really want to do the best for everyone. And sometimes they are mistaken, hygienists, into thinking that the best thing that they can do for their patients is to keep them from having dental treatment done, dental work done. They think dentists sit on a pile of money, that dental hygienists are cranking out a pile of money all day long, and that the dental hygienist gets very little of that. They think that the dentist just runs off with all of the money, and the dentist, on the other hand, thinks that because the dental hygienist is having relationships with their patients or talking about off-topic things that the dental hygienist is not producing and not providing the entire practice with enough income to pay the overhead and pay everyone's salary. Jobs are scarce, right? There are 50 or so jobs, 50 or so applicants per job. The way that we get paid is by hygienists purchasing services with money. That money gets converted into the paycheck, and then it allows for the relationship to be a little bit different than a social relationship, and the patient will trust the clinician and ask for more dentistry, or trust the clinicians enough to accept treatment plans. What the wrong message is that some people have in their mind is that the patients are there for us to find work on, and we want to charge them for things as often as possible. The dentist gets a huge pile of money with that model, and the dental hygienist gets less money, and they get disrespected on top of it. But really, all money comes from the patient. Patients are buying excellent care. Not diagnosing is not excellent care. Patients get comfortable with coming to the office over and over again and not having any treatment recommendations. And when there is one, they become resistant because they're not used to having anybody find anything. Some patients will go to a dentist or seek someone out who will never find anything, or never blame the patient for this or that, and then they can get away with not having any treatment done, which of course makes for bigger and bigger treatment cases later on. This is not the model that most dentists practice out of. Some people think that this is how it works. It is not. Dentists are very ethical. There are very few who are not. You're always going to stumble on somebody. There's always an exception, but for the most part, dentists are not always taking advantage of their patients. All dental hygienists think that they are providing excellent care. Even the hygienists who don't do all that they can be doing. They don't perio chart, they don't do oral cancer screenings, they don't do this, they don't do that. Those hygienists also think that they're providing excellent care. We have kind of a teeter-totter that we work off of with emotional ties to our patients, and then we have this perceived need to sell dentistry. And it's not about selling dentistry. It's offering services to bring patients to their optimum level of care, of health. We've got this new thing, this oral systemic link kind of thing, and people think that they can chase that down. But for the most part, what's been happening is that we just say, oh yeah, if you don't floss, you're going to have a heart attack. And they just kind of drop it at that when it's so much more complex. Most of our treatment is exciting, but this is not real dental hygiene work. Anybody can be taught to scrape stuff off of people's teeth. This is what gets posted. People think this is fantastic. This is why office managers ask us to come in for 1 hour. Because if this is all that we do and this is what we think our job is, then why not just come in for an hour? We know a lot about oral systemic health, and we need to apply it. We need to know that we can help our patients at another level. Our nutritional background isn't extremely huge, but we know more than just telling patients to get off of sugar. That's not what we're there to do. They already know they shouldn't eat sugar. So what are the options that we have for our patients? We need to apply this oral systemic medicine all the way back to the airway and tongue tie issues, and offer patients solutions to problems that they don't even know that they have. That isn't just a cosmetic solution. We can manipulate oral biofilm that can help reduce costs for the patient and reduce medical costs downline for the patient. So we can help them in a number of ways by manipulating their oral biofilm, helping them to choose the right dental product. We don't even know what's in half of the stuff out there. If they don't advertise in our journals, we have no idea what's in there. We have no way of helping our patients decide which product is best to use. Our infection control knowledge is probably the most active than anybody in the practice. And yet this is a job that is handed off to dental assistants, many of whom were just, high school students last week, or they had a job as a, gas pump attendant or something along those lines. There's no real formal education for most dental assistants, which is not to say they're stupid, but infection control is pretty fussy, and this is something we spend a lot of time on in school. Pediatric exams are very still uncommon in general practices where patients are seen under 1 year of age, and this is where a dental hygienist can really shine with offering guided anticipatory guidance for the patient's parents, so that we can have a conversation that lets the patient know, the parents of the patient know, that we can provide guidance so that their child never gets any dental disease. We know how inflammation works, and yet still we just kind of lean on the floss argument and blame the patient, where dental hygiene is critical in reducing the inflammatory load in the body in patients that have periodontal disease. This oral systemic link can be put better into practice. We can do more, way more than what we're doing, and nobody knows really how to do it. And that's why I've started this New Eyes approach to dental hygienist practice. I'd like to help hygienists see things differently so that they can approach their patients more broadly and have a better relationship with their patient. These are a couple of studies that were compiled at the Cochrane Review. Cochrane reviews do not work in dental literature. You can't do anything with a Cochrane review in dental literature because there is not enough literature to compile to come up with any kind of conclusions. And you can see in this series here, this is 2005, insufficient quality of research to reach any conclusions. They found the same thing in 2007. There's still nothing printed. There's no research done to show what dental hygienists are doing to their patients is healthful. Okay? Then in 2013, they have the same thing. Right? They're still waiting for better and more trials. But what the insurance companies have done is that they have found ways to prove that dental hygiene treatment saves the patient money. And all of a sudden, we are relevant. This was a study that was published in 2013. Another insurance company, United Healthcare, went through their records and pulled out codes for their patient members. And they found those patients with chronic obstructive pulmonary disease had annual medical costs $1,185 lower for those patients with COPD who had dental hygiene treatment. Members who received periodontal treatment had the lowest costs. Compliant members receiving a prophy had lower costs than those who had perio treatment in the congestive heart failure group. Of the non-compliant patients, they saved over $7,000 annually by having dental hygiene treatment. And they saved over $8,000 annually if they were compliant. That means that they were compliant with their physician, not just with their dental hygiene treatment. This was a study that was published earlier in this millennium, in the 2000s. I think it was 2008. Middle ear infections or respiratory tract infections during the first year of life is associated with significantly increased risk for developing early childhood caries. 1 in 4 children will have an ear infection by their 3rd birthday. Can a dental hygienist reduce ear infection costs? Of course we can. We can help our patients get a referral to a dentist for evaluation for dental decay. We can have an open dialogue with the pediatricians when they find children who continuously have ear infections at an early stage. We can help by reducing the strep in the mouth that helps to contribute to that. We can check for airway issues. We can check for tongue-tie issues. All of those things contribute to early childhood decay and ear infections. Downline medical costs are really at the heart of this issue. And we have insurance studies that show that dental hygienists really do decrease costs. And they didn't go out and find master's degree dental hygienists. They didn't do this in any other way than just looking at their patients who saw hygienists in regular clinical dental practices. Hours and hours are lost. Productivity is lost because of dental visits. And dental hygienists know that dental hygiene really can provide a lower dental cost. And dentists can know that they can start treating their patients for more things than just dental decay. Many, many, many dentists have come to me and said, Shirley, I just can't stand this drilling and filling anymore. Look at this bucket here, healthcare costs. The number one listed here is preventable chronic diseases. Dental diseases are preventable. The two big ones, obviously, caries and periodontal disease, are preventable with dental hygiene care. Dental hygiene care reduces ventilator-associated pneumonia infections in hospitals. This study was also done in a hospital where nurses were providing the care. The total cost of the care protocol was $2,000 for the year, but that $2,000 reduced ventilator-associated pneumonia by 46%. And that showed a decrease in cost system-wide up to $500,000 that year. So that's the kind of information that we'll be using and learning how to use in your dental practice in the New Eyes Dental Hygienist Guided Mastermind. It'll be a 1-month commitment only. I didn't want to be a consultant that comes to an office and is there for 3 months and flying and staying in hotels and working with money and all this other kind of stuff. That's not what this is at all. We'll have an online meeting once a week for a month. We'll have a very tight agenda so that we stay on track. We're going to learn from one another, and we're going to tackle one major topic per month. So the online meetings will be about an hour and a quarter. So you'll have to take time off of your work in order to do that, which increases the value of this appointment. You'll be asked to do some data gathering based on the patient charts, but you will not be reporting any specific patient data. So it will be a compilation of what had happened last week. And it's not going to be production focused. There is a production piece. Obviously, there's always going to have to be some money, but it's not all about production. I'm a firm believer that if you treat your patients really well, then the production will come after that. So you'll find that you're going to have improved patients' health, which is improving your practice health and will also improve your own dental hygienist health. You'll be able to balance your time more effectively so that the stresses that we find accumulating in our body don't become such a big deal. The first month, we'll be focusing on periodontal disease, ways to make a diagnosis, and how to really integrate this diabetes component to perio. The next month, we'll be focusing on caries management, caries diagnosis, not just cavities, and treatment for caries infections, not just holes in teeth. And then we'll also spend a month focusing on the airway. And as these masterminds continue to grow and evolve, we'll increase the number of topics that we'll be approaching. I'm sure the periodontal one would be perio 2, perio 3, perio 4. We'll have small groups, only 8 members per group. We'll never get done if we have more than 8 people in a group. If necessary, I'll have 2 groups or 3 groups or 7 groups or whatever. But that's just how it's going to have to be. We can't manage a conversation with more than 8 people. The meetings will be guided sharing, and we'll have a firm end time. And we'll develop attainable goals that are based on processes that you'll be able to handle in your own practice. You'll have complete email support. I'm developing a wiki platform to communicate within the group. So we'll have a private online meeting space that you can meet separately if you want to, or at least post your findings so that we can share during the rest of the week. And we'll have team learning that way. And that doesn't mean that everything is going to be costly. There will be free stuff. Every single person that signs up will get a free copy of the Purple Guide Paper Persona. When we wrote this book, we intended it to be for clinicians who have been in practice. It includes a resume for every 5 years that you're in practice. What is a CV? Why is it important? What's a portfolio? Why is a dental hygiene portfolio so important? Most important for this topic is that it acts as a career guide and kind of guides you along as to what you can expect as you go through your dental hygiene career. As I said, my name is Shirley Gutkowski, and these are some of the reasons why you should care what I have to say. I've been in practice a long, long time, and not just chairside. I've been speaking to dental hygienists around the globe for 15 years now. So I have a lot of background to pick up from, and not many hygienists have that. You know, that's why consultants are the consultants. They have a wide breadth of background, and that is what I'm going to be bringing to this. And I don't, I'm a hygienist too. The money part I know is there. I know I have to produce, but it's not something that interests me. I don't want to know the entire practice bottom line. So being a frustrated person, I'm always looking for ways to change things. So as I said, weekly meetings, you'll need access to your charts and a desire to go to your next level of clinical dental hygiene practice. We have a pretty substantial glass ceiling in dental hygiene in the dental practice, and that doesn't mean that there's not more that you can do in the practice. Sometimes we just look up and we're like, well, I went to school for 2 years or 4 years. I've been practicing for 25 years. I'm making as much as everybody else in the office, even the 2-year people, and I don't know what else I can do, but what I'm doing isn't working for me anymore. So there is a next level of clinical dental hygiene that you can approach, and we can talk about how to make your doctor be thankful and grateful for that. So the financial commitment is in a ballpark where I think most hygienists can afford. Because it's a small group and because the cost is a little bit more consistent with the income of a dental hygienist, and get a free copy of the book, I think that the cost of $720 is pretty reasonable. Except that for the next 4 people who sign up, because I already have a group of 4, I'm asking just $360 for this first group, the first 4 people who sign up. So as I said, I already have 4, so there's only 4 more slots open. And you can do that by registering on my website, rdhpurpleguide.com. Now, you can get a copy of the book from here, but you'll get a free book by ordering the services. You'll go to rdhpurpleguide.com and click on Services, and then you'll click down here to the New Eyes Dental Hygienist Mastermind, Guided Mastermind, and then you'll go through 2 or 3 screens before you get to the payment information screen that looks like this, where you will apply the coupon, and the coupon is half off. I'm very creative on certain parts of the day. So just type in half off and you'll only be charged the $360. So we'll be starting July 7th at noon Central Time. So that should give you enough time to clear your schedule or move patients around a little bit. Since it's a mastermind, your brain will be overflowing with new ideas as you come into the meeting and as you exit the meeting. So just be prepared for that. We'll be using each other to learn in a new way, in a collaborative way. So we'll be forming new paradigms to replace the old. We'll get rid of some of the things that you've been doing in order to make room for the new things that are coming. You can contact me via email if you like at crosslinkpresent@aol.com. I've had that email address for almost 20 years now. I've been an AOL member. I am loyal. I do have some Gmail accounts, but I prefer to just stick with this AOL one. It makes people laugh, and it still works fine for me. So that's how you can reach me. And that's the name of it, New Eyes Dental Hygienist Guided Mastermind. That's what I look like with the goofy face going on there. And I really look forward to exploring these options with everybody. I think it's going to be pretty exciting. And you'll be able to really provide another level of care to your patients that you're going to be very, very comfortable with. This is not a scripted, you have to say these 4 things, you have to say this way. This is something that you will own yourself. The hygienist's role is in here, and that's what we're going to be working with your head, with your mind, partly of your heart, right? We're not just about brushing people's teeth. That's not it at all.